back for another video 2 weeks later. 2 weeks later, we are back with another video, and I'm excited about that because I want to be able to push myself a little bit and do at least 2 videos a month. And don't you think that's consistent enough? I think so. I mean, I can do better, but I think that's a start. We'll see. Hopefully, I can keep it up. Yeah. So in today's video, I wanted to share 10 things you should know before you consider a career in dental hygiene. If you're in high school or you're in college, still deciding what to major in, or you want to go back to school, these are the 10 things that I want you to keep in mind as you make your decision to become a dental hygienist. Um, just because I'm a dental hygienist doesn't mean that I'm only going to talk about the good things, okay? We're gonna keep it real. We're going to talk about the good, the bad, and the ugly, okay? Okay. The first thing that I wanted to share is that dental hygiene is actually a great career. You get to make a difference in your patient's life and smile. I'm saying loud because your mouth is actually connected to the rest of your body. Yeah. You see this? It's connected to that. Like it's one. And do you know how many diseases are linked to periodontal disease? Like literally, you do get to make a difference in your patient's lives. Your patient with diabetes, your patient with um, Alzheimer's. It's a lot. It's a lot of disease that are progressing because of your periodontal disease, and we get to lower that risk. And as a dental hygienist, you can make a living. You make good money. Um, your pay may be vary from state to state, but if I'm going to be honest with you, a dental hygienist should not make less than $40 an hour. I actually don't care what state you live in because of because of our job, the services that we provide, the differences that we're making. Preventive. We're preventing. Okay, we should get paid for our education, for our services, for the difference that we are making in this patient's life, in this patient's mouths. So yeah, nothing less than $40 an hour. So yeah, you do get to make a difference, and you get to make a living for yourself as well. So everybody's happy, right? The second thing I want to talk about is the schooling. It is very, very, very competitive to get into a dental hygiene school. It does not matter where you at, what state you're in. It's gonna be very competitive. The schooling is actually 4 years, 2 years for prerequisite, and the other 2 years into the program. Before you can even apply to the program, you have to complete the prerequisite, which are majority of science classes that you have to take, and your grades has to be spot on. And by spot on, I mean barely B's, mostly A's, and also high GPA. Well, if you have mostly A's, you're gonna have high GPA. They look at that. It's a very, very small amount of students that they accept every year. So make sure that you do your research on the school that you want to go to and see what the requirements are, because the prerequisite can be slightly different from school to school. It's about 12 different classes that you have to take as a prerequisite. It's a lot. So which is why it takes 2 years to complete that before you can apply to the program. And so, yeah, it is not easy. It's very competitive. Do your research, see what school you want to attend and what the requirements are. Just keep in mind that you have to be you have to want it bad enough. You have to want it bad enough. Otherwise, you're just going to keep applying every year, and it's not guaranteed that you're gonna get in. Number three, the third thing I want to mention is that it is hard to get in, but it's even harder to stay in. Because once you're in the program, my program specifically, if you fail one class, bye bye. Like your whole career is over. They kick you out. Yeah. You're taking multiple classes at once, and by multiple, I mean like up to six classes at once. And if you fail one of them, you're out. You are required to find your own patient. And while you're in the program, you are seeing at least 40 patients. You have to come up with 40 people to treat. And by that, I mean not just everybody that has the same condition. You have to find people different age range. You have to find people with different oral health. And I mean like people with healthy mouth, people with periodontal disease. You have to find a different range of people to bring in as your patient. You are responsible for that. And also, it is not welcoming to work. You have a lot on your plate. It's not welcoming to work. I did it. I had a part-time job. I mean, I had to because um, you're going to have to come out of pocket for thousands of dollars for expenses that financial aid won't even cover, and that is if you have financial aid. Um, yeah, you have to buy your own instruments, you have to buy your own. It's a lot of money that you will have to come up out of pocket. Find your own patient, buy your own stuff. It's a lot. It's a lot. So keep that in mind as well. Another thing too that I want to mention is the grade scale. Very different to what you used to. Okay, while you might think that a 74 is passing, you got a C. A 74 is an F. Like that's an F. You got a 74 in a test, you failed that. Yeah, and yeah, in my school, a 75 and above. Okay, a 75 is a C. 80 is a C. If you want a B, 82. And 82 is the B. Okay? A 90, that's the B. Okay? You need an A, 92. And I was talking to someone who went to a different school. Their passing grade was actually 82. If you have an 81 on a test, that's failing. Yeah, I'm not laughing because that is traumatized. That is let me not try to traumatize y'all. I just want y'all to come prepare, know what you're getting yourself into. But yeah, mhm, yes, 74. Depending on what school you go to, 74, 80. All right, let me stop. Yeah. All right. So as for number four, the fourth thing I want to say, the job is hard on your body. Okay. Now you're a dental hygienist. You went through it. You survived school. You came out alive like I did, barely. Um, you're working. Your back, your neck, your hand, your wrist. This right here, this is your whole career. Okay? Take care of these. These, something happened to these, say bye bye. Say bye bye to your career. You don't have a career anymore. Your body, take care of it. You literally seeing patients back to back. And you are like this, literally just like over your patient for an hour. Okay? It's a lot. This right here, by the time you're done at the end of the day, this is sore. Your back, your hands. It's hard. It's hard. It's very hard. Take care of yourself. Work hard if you can, and invest in your career. And by investing, I mean you have to invest in things that can help you take care of your body, like ergo loops. An ergo loops is the loops that you put on and it allows you to to sit straight with your back straight and you actually looking through the lenses at your patient. So you working like this instead of bending down. That's way more money than um, standard regular loops. I spend over 2K for my loops. Yeah, out of pocket, out of pocket, over 2K out of pocket for some glasses with some glass, you know. Yeah. Mhm. Yeah. Otherwise, by for the next before I even hit 10 years in my career, it would be no more. Yeah, I would have to find something else to do. I had to. I wanted to. I'm not gonna say that I had to. Do you have to? No, you can figure something else out. But I wanted to. So yeah, I did. I got the Go Loops and a saddle chair. So the chair that we have, they're not made to support your back. So find a chair that can support your back. And another thing too, we have had throughout school they teach you the proper way to sit and treat your patient, but sometimes we don't really actually learn that. Especially out there, we see different patients with different abilities, physical abilities. We have to accommodate them. We have to turn, twist, do whatever we can do to provide the services that we do for them because we cannot bring the chair all the way down. Now we have to stand. We have to, you know, it's just hard on our bodies. So you have to take care of yourself. Otherwise, it's just you're going to be doing a job for 5 years, the most, and now you just can't work anymore because of your wrist, your back, all of that. So yeah, keep that in mind. The fifth thing I want to talk to you guys about is most of these dental offices out there they don't provide health insurance. Um, if you're used to getting health insurance through your employer, then you might have to know what's important to you when you're looking for a job. Ask them what type of benefit they provide and make your decision based on that. But yeah, getting your own insurance is very, very expensive. It's expensive. I do not recommend it. But I actually kind of like the idea of, going through that process on your own, but it's expensive. And, a lot of people say that, we make enough money to do it on our own, but to some of us, we just would rather, get it through our job. And so, yeah, that's one thing to keep in mind. Look for a job that has good benefits if that's important to you. Because some of us, we just want to get our check, go and provide the best care possible to our patients and get paid for that and, take care of everything else on our own. So, yeah. Number six, because a lot of people they don't understand the importance of dental health, they would come in and try to disrespect you in your profession. They would come in and demand what they want. Like I've had patients that has not been to the dentist in a while, and they would come in and straight up tell me, "I only need a regular cleaning." Like, sir, ma'am, no, I will do the assessment and I will determine what type of cleaning you need. Okay, I'm your provider. I'm the one with the license here. And my job is to provide standard of care to you. You don't come in and tell me or demand me what I have to do. No. If that's the case, go find somebody else to do it. Do not be afraid to let your patient walk away because it's your license. Okay, you took a vow, and the vow that you took is that you are going to do your best and you are going to provide standard of care to these patients, and that's the job. That's what you should do. When the patient come in, you do the assessment, the period chart, the x-rays, that you do everything you need to do to know where they at them. specifically, individually. You do individual assessment to see what type of cleaning the patient wants. You don't come here and demand me what you want. If you know what you wanted to do, what you needed, then you take care of that for yourself. You come here to find something out. Let me tell you what it is. Okay, I'm the provider here. I'm the professional here. So you have to be firm with your patient and you know act like the provider that you are. You are the professional. Don't let the patient walk all over you, disrespect you and your education and your intelligence. Don't do that. Don't let them. And also, too, when you go to a job interview, you have to ask about. Sorry, you have to ask about the office policies because some offices would let the patient disrespect you and still let the patient stay. No, no. Mm-mm. So ask about, that before you accept the job. As for number 7, your new normal when it comes to work hour would be 3 to 4 days a week. Yeah, you do have that work-life balance when you are into hygienist, which I love because I have 2 kids. I want to be able to spend time with my babies. I don't want to be working um, every day, which I do now, but eventually I won't be. Okay, because it's a lot. But yeah, your new normal is 3 to 4 days. That's what we consider full time. We consider 2 to 4 days full time. Um, Anything less than actually 3 days would be between, depends on how long you work, would be between part time to full time. But like 2 days part time, 3 days part full time, 4 days, 4 to 5 days full time. But yeah, you don't work on holidays, you don't work at night, okay? And you don't work weekends. No weekends. You have your weekends to yourself. But I have to say that though a lot of offices now they start opening on weekends. So if you want to work, what the heck was that? Sorry. um, a lot of offices are opening on weekends, and if you want to work, extra hours during the weekend, you can, because you will have that opportunity to do that. Um, Number 8 is kind of, because when it comes to opportunity for growth in dental hygiene, it's a question. It's a question mark. Yes, you do have different things that you can do, different settings where you can work, but as far as growth, I don't think there's like a lot of room for growth. I don't think I don't think so. As like in nursing, for instance, there's so much you can do. There's so much you can do going back to school in that branch of field. There's so much you can do. But hygiene, not so much. Not so much. Beyond clinical, it's just not much room for growth. It's just not. Um, but yeah, you can do your research because as a dental hygienist, you can become a researcher, you can become um, an educator, you can become. There's so much you can do, but as of, I just, uh, yeah, mm, yeah, I just don't see room for growth. I, I don't, not much. So yeah. Number 9, you do feel a sense of purpose. It's like you have a purpose um, when you are a dental healthcare provider because I feel like people have little education when it comes to that, and you are able to educate them and let them know what they have going on inside their own mouth. It's fulfilling, With that being said, number 10, if you have done your research and you've decided dental hygiene is what you want to do, definitely go for it. It's worth it. Definitely worth the hard work, the sleepless night, the crying, because I did a lot of that. It was it was not easy. Um, yeah, it's worth it. Definitely worth it. I'm not gonna say that you're going to be completely happy, in your profession. I feel like every profession, if you're a doctor, if you're a nurse, whatever you are, you're gonna, there are some challenges. You're not gonna be happy all the time, but definitely you're gonna love it. Cause I love it. I love it here. Anyway, I think that's it for this video, guys. Let me know if you enjoyed the video and leave a comment. Don't forget to subscribe, like, and let me know if you guys want me to do another 10, 10 things. I can like kind of switch it around and bring you guys another video of 10 different things that you can keep in mind when it comes to dental hygiene, dentistry in general. And so, yeah, thank you. And I will see you guys in the next video. Thank you, thank you, thank you. Bye bye.